It's a people, it's a community, it's a life, it's a heart, it's a spirit.
The heck would you want a picture of a tattoo of $1,000 on your penis for?
The medications that have now come out really make HIV a manageable disease.
Like I said, in today's market, real estate alone has gone up 15%.
So sometimes there is no battle. Lately, if I don't get my musket dirty, that's great with me.
The cops were pushing her and egging her on to get her nuts. They were calling her names.
And then I find that the actors and actresses, for the most part, are like sponges. They soak up whatever you give back to them.
And he kept explaining to me that I wasn't gay, that you cannot be gay.
Religion and spirituality are big, big topics these days. I mean, the bookshelves, the bookstores are full of
incest, not funny. Midgets, not funny. Incestuous midgets.
Get it funnier.
Good evening and welcome to Talking About. I am John Griffith, your host, and tonight we are talking about breast cancer, and my guest is Ms. Pat Spicer, the Program Coordinator of Breast Cancer Programs, Cancer Care of Long Island. Welcome.
Thank you, John. Thank you for inviting me.
Brief overview of what Cancer Care of Long Island is all about.
Cancer Care is a professional agency that provides counseling, emotional support, and in some instances financial assistance to cancer patients and their families. We start very often before people have a firm diagnosis of cancer through treatment, hopefully through cure, and occasionally through death and through bereavement. The counseling and supports is provided by Master Levis social workers who are trained as oncology social workers, and our programs are free of charge.
We're talking about breast cancer. Exactly what is breast cancer?
Well, that you have to understand that I'm not an MD.
Okay.
But breast cancer is a proliferation of what would ordinarily be normal cells that somehow have had their switching mechanism turned off, and they are proliferating at a hideous rate within the body, so that they are cells that have turned abnormal. The normal cell process is a birth-death process. Cells self-destruct. With cancer cells, instead of destructing at the end of the cell life, they continue to grow and they override the healthy cells.
Okay. So it's just out of control.
It's literally out of control cells within the body.
Okay. Is there just one type of breast cancer? Or?
No, it's kind of like when you say breast cancer, it's a little bit like saying the word cat. It can be anything from the pussycat in your living room to a lion sitting in the jungle. And breast cancer is very much the same way. There are various types of breast cancer, starting with DCIS, which is ductal carcinoma in situ, all the way up to inflammatory breast cancer, which is a very virulent form of breast cancer. But there's a whole range of diagnosis and types of breast cancer in between that.
What is the most common form?
The kind of garden variety breast cancer is intraductal carcinoma. That can be either infiltrating or in situ again. If it's infiltrating, it means it is, while it has grown in the duct, it has broken through the wall of the duct.
Into surrounding.
Yeah.
And who is at risk? How many people are diagnosed with breast cancer annually, say?
Numbers are kind of hard to do. Who is at risk? You're at risk if you're a woman. Every woman is at risk. For some people, the risk factor is higher than for others. We have been doing much better with breast cancer. Fortunately, women are diagnosed earlier, so the survival rates are getting better. And actually, for the last 5 years, the death rates have been going down from breast cancer, which is wonderful news.
So, is it exclusively a woman's disease?
No. It's much more a woman's disease than it is a man's disease. The percentage is about 1% for men diagnosed with breast cancer, but the majority of diagnoses are in women.
Okay. Are there any commonalities or specific risk factors?
Well, that's controversial because, as I said before, the greatest risk is just the fact that you're a woman and that you have hormones throughout your body, particularly estrogen, that you're going to be subject to from the time of the onset of menstruation all the way through postmenopause. The greatest risk factor is age. Most breast cancers occur in women who are postmenopausal, and your risk factor increases over time, so that the common number that's used is 1 in 8 women will be diagnosed, but that's across their lifetime. That's not if you line 8 women up in a room, one of them is going to get breast cancer. So people get frightened by the numbers, but the number actually is higher on the other end, that once you hit 70 or 80 or even 90, you're at the high risk pool.
Okay,
And there are a number of other risk factors. Your diet is a big problem.
such as, I mean, what kind of...
Well, Americans eat a lousy diet.
Well, yes, I mean, I have a nice middle section to prove that.
Sure. Well, no, you don't look like you have a problem. But we eat a diet that's high in animal fat and high in dairy product. And those are two commonly difficult risk factors in terms of the amount of that we consume. There are other people who don't exercise, who do nothing in terms of exercise, who are overweight. Obesity is a definite risk factor. If you are a steady user of alcohol, and I don't mean somebody who has a glass of wine with dinner or a couple of glasses of, wine at a celebration.
However, a bottle of wine
or a
with
bottle
dinner.
of wine. But someone who drinks more than 3 drinks a day on a regular basis is at risk. If you're a smoker, you're at risk. You're at risk for so many types of cancer if you're a smoker or a drinker that it isn't even funny. And if you're drinking or smoking, if you have a problem with alcohol, get help. And the same goes for cigarette smoking. It's a good idea to quit and quit fast.
Right. So, I mean, essentially, the body's a machine. Anything you do to throw that machine out of whack
is
can...
going to have a profound influence on it. There are genetic factors. Women who are of Ashkenazi Jewish descent carry a mutation gene, the BRAC1 or BRAC2, BRCA1 or BRCA2 genes. It's only present in about 10% of women in the population, but it is certainly a risk factor in terms of breast cancer. The BRCA2 gene is also a risk factor in terms of ovarian cancer. When you had your first child is a risk factor. The younger you are when you have a child, the better it is. So that influences, if you've never had, women who have never had children, there's a rate of breast cancer in nuns that is out of the ordinary because they don't give birth naturally as part of, so that you find that if you have your children in later at life, you're more at risk for breast cancer. How early you started menstruation, the earlier you start, the more at risk you are because your body is bombarded with hormones for longer periods of time.
Girls starting younger and younger just because of nutritional factors?
Yes, well, again, we eat a very high fat diet, a high nutritional diet, and yes, girls are starting as young as 10 with their menstrual cycles. We're delaying having children into our 30s so that you find that the time that your body is producing amounts of estrogen is much greater, and that increases your risk factor.
There's been a lot of discussion recently about birth control pills as well.
Actually, nobody has been able to establish that contraceptives are a risk factor. There was a lot of discussion about coffee, about chocolate. There isn't really good hard research that says it is a factor. Women with fibrocystic breasts, which is not a cancerous breast condition, but which is what kind of women refer to as lumpy breasts, they are usually asked by their doctors to avoid high amounts of caffeine. But for breast cancer, it really isn't a risk factor.
Okay. Well, how do people most commonly detect breast cancer?
Lots of women find their own breast cancer. They do self-examination on a regular basis, and they find, well, even if they don't, they find it themselves in the shower. We advocate a 3-step program as part of a detection, and that's a mammography starting at age 35, a baseline mammography.
Okay, for those who might not know exactly what that is, and could you tell exactly what a mammogram is?
Sure, but let me talk a little bit about the 3 steps. We also a clinical breast exam at least once a year by either your nurse practitioner, your gynecologist, or your family doctor, and self-breast exam at least once a month, usually 7 to 10 days after the start of your menstrual cycle. Kind of mark it on the calendar, pick a date that you're comfortable with. If you're postmenopausal, either pick the first or the last day of the month and do it regularly on that basis. But many women find their own lumps. Now, to go back to what is mammography, mammography is a picture that's taken of the breast with radiological equipment by compressing the breast so that they get a clear image of what is happening within the breast. Some of the newer, the mammogram mammography systems and the digital mammography systems are much better, particularly with younger women who tend to have dense breasts, and they are much more clearer pictures and much clearer images. Mammography is covered by Medicare. Yeah. It's covered by most insurance companies, and there are a number of free programs.
It's a safe process.
It's a safe process. There are no real risk factors. There's discomfort. Yes.
Discomfort.
Well, if you think about taking something that's literally soft part of your body and squeezing it, it's uncomfortable. But if you think about the benefit of the discovery, what you can find on that mammography, it's worth it. I should caution people to realize that mammography is not foolproof. There's about a 10 to 20% margin of error, so that very often a woman will say, well, I went for my mammography and it didn't show up. I found it when I was doing self-breast exam. So there is a small percentage where it's not going to show in a mammography. Very often a doctor will say, let's do a sonogram, which along with it, which might be more indicative of what's happening within the breast tissue.
And a self-exam, is there literature that you can get from your doctor or visit your website?
You can get it from your doctor. You can call our agency. We will send it to you. The American Cancer Society will send it to you. There are agencies all over that will gladly provide it. Local hospitals, particularly those with breast health centers, will gladly provide you with information on how to do self-breast exam.
And just without going into too much explicit detail, is it a simple process?
Very simple once you learn how to do it. It's really easy to do. There are shower cards that you can hang in your shower because when your skin is wet and soapy, it's easier to move your fingers over the surface of your breast. Most women do it in a circular pattern. Some use what's called a wheel and spoke, where they use kind of a linear pattern as opposed to that. But become familiar with the geography of your breasts. It's really important so you know what it feels like, and if something is different, something is strange, then call your doctor right away. Don't wait.
Okay, which was going to be my next question. What happens when you do find something? So get in touch with your doctor.
The first thing to do is don't panic.
Okay.
Most breast lumps that women find turn out to be benign. But the important thing is to go to your doctor right away. If sometimes, and it's important to remember that not all doctors do good self-breast exam, if you still think that lump is there and you're not happy, go on to another doctor, find another physician, and have him or her do an examination.
Do you mean there are bad doctors?
There are not bad, I'm not saying bad doctors, but what I'm saying is some doctors are more adept at doing breast exam than others. Usually a woman's gynecologist has a good idea of what's happening within her body. You see your gynecologist regularly, so that they are sometimes more adept at doing it. But don't hesitate to ask to have somebody else. Don't hesitate if you're uncomfortable with what they're telling you to ask to have a sonogram done, which is very often more indicative.
Okay, and then what happens when somebody does hear those words, you have cancer?
Well, first, before they're going to hear you have cancer, you're going to hear what we need to do is further testing to determine whether you have cancer.
Okay, and what further testing?
Well, one of the tests that they might do is the sonogram that I talked about. If there's still a suspicion, they might want to do an MRI or a CAT scan, or they might decide that what they need to do, they know there's a lump there or there's something there that they don't like the looks of, they might decide to do a biopsy. A biopsy is a simple surgical procedure whereby the doctor makes a small incision in the breast and then takes out a sampling of tissue. There's a new way of doing it with what's called a stereotactic, where they use a punch tool that takes little kind of dots of material out, and it's much more efficient and less painful than having an open surgical biopsy.
Okay, well, we have our first phone call. We have Stacy on the line, and as soon as Stacy is with us, if she would just be kind enough to say hello. Stacy, are you there? Stacy?
Hello.
Hi, Stacy.
Hi, Stacy.
Hi.
Yeah, do you have-
I was wondering about tamoxifenolin. If there's another pill that you could take instead of tamoxifenolin, and what are the side effects?
Amoxicillin is an antibiotic. Are you talking about tamoxifen?
Tamoxifen.
Okay, tamoxifen. Yeah, there are other hormonal therapies that have come along recently. Has your doctor put you on tamoxifen, Stacy?
Yes.
It is the most efficient one. We have 20-year data on it. We know it's preventative for a recurrence of breast cancer. There are other hormonal therapies that you can discuss with your doctor, but it is probably the one that we have the best data on and we know the most about. What are your concerns about it, Stacy?
Well, the side effects, if it's going to give me other type of cancers in my body.
The percentage of women who develop any kind of uterine cancer is really relatively small. You have to look at benefits outweighing risks, and it's something you should certainly talk about with your doctor. But if you're really concerned about it, I would suggest that you ask him about one of the alternatives that might be available to you. But there are other hormonal therapies that he or she can prescribe.
What was the latest pill? They said was the latest pill.
Are you talking about Femara?
How do you spell that?
Femarra, and it's mostly for use in women with more advanced breast cancer. It's not used as a preventative the way tamoxifen is. There is another one that's currently in the STAR trials called Raloxifene. It has not been approved yet by the FDA for breast cancer. And there's also Aromacin, which is one of the newer hormonal therapies that has just been approved, and that's also been used as a preventative. Does that answer your question?
Yeah, I just wish I could know how to spell all these words.
I'm sorry, I don't know how to spell all of them either, but your doctor sure does. And if you want, you can get to our breast cancer website. Do you have a computer?
Yes.
Okay, www.cancercare.org, and a lot of that information is listed there.
There is a wealth of information listed
Oh,
there.
yeah, it's a great website. We've won awards with
Oh,
it.
great. Thank you so much.
You're quite welcome.
Thank you for your call, Stacy. Okay, now back to, we've gone through all the testing.
You've gone through the testing, and the biopsy has come back, and the biopsy is positive.
Right.
Most women at that point in time will want to see and get a second opinion. So they take their slides, preferably to a surgeon who specializes in breast cancer. It's a particular area of specialization. A general surgeon is good if that's what your insurance plan covers, but there are surgeons who do 100% of their practice with breast cancer, and they are going to be able to give you the best choices in terms of what's good for you and what will work in your individual circumstances.
And second opinion is up there on the priority list?
Yes, actually, most insurance companies, in fact, some of them request or require that you get a second opinion, so that it's a good thing to do for your own peace of mind, because many women, when they get the biopsy back, their initial reaction is, they made a mistake, this is not me, this couldn't
Denial.
be happening to me. Yeah, and in the beginning, you kind of need that to get yourself going. But hearing it sometimes a second time, having someone else read the slides, it's a good idea, and it's reassuring in some ways that yes, they didn't make a mistake, and now I can explore what my treatment options are.
Knowing is better.
Yeah.
And speaking knowing your disease, knowing how much research should somebody do.
Well, that's a fine line. There are women who come into my office and they've got folders this big stuffed with information, and they've read every book in the library, and they've been on every website that's on. For some women, it's reassuring. The more knowledge they have, the more comfortable they are. And I would urge every woman, sometimes it's hard to sit and hear it, but to develop some knowledge of her disease and what her treatment options are. There are some women who can't deal with it, and that's fine too. They just say, let my doctor do whatever he wants to do. I trust him, and I don't want to know. And that's okay too.
And just put yourself into...
Yeah, if you trust your physician and you believe that he or she is sincerely doing the best they can, that's fine. But I think for most women, having some knowledge at least about what is happening with their own body is empowering, and it gives them back a sense of control.
Okay. And we do have another caller. We have Gloria on the line, and when Gloria is with us, I hope she'll say hello. Hello, Gloria. Gloria?
Hello? Can you hear me?
Yes, I can.
Hi, Gloria.
You have a
Hi.
question today?
Yes, I'm wondering what happens to a woman's state of mind when she discovers that she has cancer. I'm sure it must be very depressing.
Well, there are kind of levels of reaction that people go through. Initially, most women are frightened. And yes, what's interesting is that the first couple of months after diagnosis, women kind of pull themselves together and manage to do whatever they need to do in terms of surgery or chemotherapy or radiation. When women are most likely to have an emotional reaction is when the treatment stops and they suddenly can stop, sit back, and take a look at what's happened to them, and they deal then with most of the emotions. And anxiety and fear and depression are common reactions. It's not anything to be worried about. They're treatable, and most women get past them very easily. But it is good to be able to seek help, to join a support group or to go for some individual counseling. And many women will require medication for the depression. That's fine. It's short term. Just to do what you need to do once you've had the diagnosis and once you're beginning to experience all those mixed emotions that happen.
Do you have support groups?
I'm sorry?
Do you have groups that help women deal with depression?
Yes, we do. I lead a breast cancer support group. We also have, I work out of Woodbury. We also have a breast cancer support group in our New York office. We have a young women's support group, especially for women in their 30s and 40s who are dealing with this, since their issues also talk about child rearing, fertility, etc. But yes, the support group is a great place to be. I would caution you to look for a group that's led by a professional, whether it's a social worker or a psychologist or whomever, but self-help groups tend to get bogged down. But support groups are wonderful. I've had mine since 1987, and I can't tell you how wonderful and courageous those women are. So if you're dealing with breast cancer, getting some help and going to a group is going to be a really good way to help handle it.
Is there a phone number where we can reach you?
We'll have a toll-free number up at the end of the show.
Okay.
So keep watching and write down that number when we get to the end of the show.
Thank you.
Thank you, Gloria. Again, as I said, I think it's so difficult. After the first few months, people are beginning to deal with the emotional reaction. It's like, oh my God, I really do have cancer. It's me. It's not some other woman down the block. So that I think that's the time people are most likely to call our office looking for help. Individual counseling is fine. Some people are private people and they're not comfortable being in a group. I think in most instances group support is a wonderful thing because you get to talk to other women and you realize that they're experiencing exactly what you're experiencing, that you're not isolated, you're not going crazy is a phrase I hear most often. Your reaction is not untoward. So that when you can share what you're experiencing with other women and women in the group, some of them have been coming to the group for years. They are past their cancer, they are cancer-free, but they come to help other people. And they say, I can tell you exactly what that felt like, and here's what I did. And so you get that kind of support that you wouldn't get otherwise. Don't be afraid to ask for help. You certainly need it. This is a terrible thing to face, and get all the help and support you can get. And very often your family can't be the ones to do it because they're scared too.
Well, and we're coming across treatment now.
Okay. That's a broad subject.
Yes, well,
we could do a whole show on treatment.
And, well, maybe one day.
But the most common treatment starts certainly with a biopsy. And you then have options depending upon where the breast cancer is and the size of the tumor itself. The most likely option for, let's start with early stage breast cancer, where the lump is 1 centimeter or maybe a little bit above, and there are no nodes involved. The most common treatment would be to offer the woman a lumpectomy followed by 6 weeks of radiation. If the tumor were larger, or if the doctor was concerned that there were nodes that were possibly involved, they might offer mastectomy, and with mastectomy, usually immediate reconstruction. Again, depending upon the individual circumstance of the woman. One of the things they will do, both with a lumpectomy or with a mastectomy, is what's called axillary node dissection. They take nodes out from under the arm and examine those for any trace of cancer cells. There is a new procedure that's being used now called sentinel node biopsy, where they inject a radioactive dye at the time of surgery and trace it back to the one major node. If that node lights up, they will do further node dissection to make sure that there's no indication of cancer cells in those nodes. Based on those nodes is what decides follow-up treatment, whether it's going to be chemotherapy, radiation, a combination of both, or as the caller who spoke before, whether they're going to be on tamoxifen or not. Tamoxifen is mostly used with postmenopausal women whose tumor is ER positive, that's estrogen receptor positive. So when the doctor does the biopsy or removes the tumor, he's not only going to be looking for cancerous cells, he's going to be looking for whether the tumor feeds off estrogen in your body or not. That's an important factor that determines how the treatment is based. Chemotherapy, again, there's a range of it depending. Cancer, all breast cancer is staged, as is most cancers. So a stage 1 breast cancer would be the one we were discussing, a small tumor with no invasion into the ductal space and no nodes. Follow-up treatment might consist of 5 to 6 weeks of radiation. If the woman is postmenopausal, tamoxifen as well. If you were stage 2, you might have a larger tumor, or there might be invasion into the ductal wall, maybe with 1 or 2 nodes. You would then look at chemotherapy, and the drugs would again depend on how aggressive the cancer cells look. Stage 3 would be a large tumor with invasion of the nodes again, or it could be just a large mass within the breast itself. It would certainly be chemotherapy. It would be an aggressive chemotherapy. Stage 4 cancer usually means that the breast would be removed and there's evidence of disease in other parts of the body. The most common forms of chemotherapy now, the gold standard is currently adriamycin and Taxol in combination, but you could be offered what's called CAT, C-A-T, Cytoxan, adriamycin, and Taxol. There was a very low-level dose that they would give with early stage called CMF, which is Cytoxan, methotrexate, and 5-FU.
A lot of information.
Yeah, there is a lot of information. But again, your doctor will go through what your treatment options are.
Okay, and we do have another caller. We have Harry on the line. Harry?
Yes, I got a quick question. Does breast implants and silicone cause cancer, or is there any danger to it?
There's been a lot of controversy about silicone breast implants. Most doctors today use saline. They have never been really able to establish a good connection between the silicone implants for breast enlargement. Unfortunately, what they do is they make it harder to do a mammography, so it's sometimes harder to detect breast cancer. And what you sometimes find is women have, with breast implants, have it detected at a later stage than you would like. But to say that it causes cancer, there's not a firm connection.
I got one more question.
Sure.
Are males subject to breast cancer also?
Yes. As a matter of fact, I have 2 men in my practice who are diagnosed with breast cancer. The percentage is very small. The treatment is exactly the same. It's mastectomy for the most part, followed by chemotherapy or radiation or both. But it is a very small percentage. It's about 1%.
Thank you so much.
You're welcome.
Thanks for calling, Harry. And you are watching Talking About Tonight we are discussing breast cancer, and my guest is Pat Spicer, Program Coordinator, Breast Cancer Programs, Cancer Care of Long Island. And we were talking about treatment, and what are some of the possible side effects of treatment?
Well, again, depending upon what the treatment is. If you're being treated with what we spoke about, the gold standard, which is adriamycin and Taxol or Taxotere, women are almost certainly going to lose their hair, which is devastating. It's almost as hard as being told you have cancer. Women will say, I woke up and looked in the mirror and suddenly there was somebody I didn't know there. The nausea and vomiting that most women were afraid of years ago has been really very well controlled. Two of the new medicines, Kytrol and Zofran, as prescribed by your physician, pretty much control it, so that most women talk about feeling kind of queasy, like when you know flu is coming on. And for those of you who have had pregnancies and have had morning sickness, it's similar to that. Diet helps. Your doctor can prescribe drugs. Fatigue is the factor that most women experience. They say one woman said she felt like a wet paper bag, which I thought was a really good description. But it's the kind of fatigue that doesn't go away if you rest. You get up from a nap feeling as tired as when you went on.
Sort of a lead body?
Yeah, yes, kind of. You drag yourself to the shower. For some women that isn't present, and I want to stress that not every woman has these factors, not every woman has side effects.
They're just possibilities.
It's possibilities, and it's a general overview. So if your doctor says you need chemo, don't get panic-stricken about, I'm not going to be able to do anything. With radiation, the factors change. There's not so much nausea or vomiting or hair loss. There can be some soreness in the throat depending upon the fields they're radiating. If you tend to burn toward the end of the radiation, your skin may get what looks like a really bad sunburn. Your doctor will give you ointment to put on it. Don't do anything yourself. And again, the fatigue is present. Radiation usually runs 6 weeks, so that by the 3rd week you're feeling pretty droopy. Okay. And it's important to remember to rest when you need to listen to your body and not push beyond what your body can do. But those are the most common side effects. Every once in a while you get someone who has a real untoward one that you really haven't seen before. But those are really what most women experience.
We have another caller. We have Anita on the phone, and Anita will say hello when she's ready. Anita, are you with us?
Hello?
Hi, Anita.
Hi. I'm just wondering, I know that some people have this fear of losing...
I'm sorry, I can't hear you, Anita.
A fear of losing their breast. Is there anything that can be done, like a replacement of some kind?
Yes, certainly. If your doctor told you that you needed to have a mastectomy, most women today opt for immediate reconstruction. And there are 2 ways to do that. Your doctor can do a saline implant, which begins at the time of your surgery, and they insert what's called an expander under the breast. The plastic surgeon would be present in the operating room. They gradually inflate it with saline on a monthly basis, so it sort of looks like you're smuggling grapefruit until the skin has stretched enough. The doctor will then remove the expander and put in a saline implant. The other way is to do an operation called a tram flap, and that is done by taking muscle and fatty tissue from the stomach, moving it up under the skin, and creating a breast out of that fatty tissue. So some women are really happy with that because they get a really very natural-looking breast, plus a tummy tuck thrown in for the price of the immediate surgery. But if you have to lose a breast, make sure that your doctor refers you to a plastic surgeon and that he or she is present in the OR when you're having your surgery, so that women today don't have to go without a breast.
Is there a window
of time? No. The nice thing about reconstruction is, first of all, if you're going to have chemotherapy, your doctor won't do the reconstruction at that period of time because you'll heal more slowly. The only consideration is if you were going to be followed by radiation, and with lumpectomies you don't need reconstruction. It's harder to reconstruct the skin after it's been radiated. But many women wait a year or 2 after their surgery and then decide to go for a reconstruction. Women say that they don't want to have any more surgery right then because it involves, again, being back on the operating table. It involves reconstruction of a nipple, and it's time-consuming. But no, you don't have to do it immediately. Does that answer your question?
Thank you. It does, but I also have a question. Do children ever get breast cancer? Children?
Do children,
Like a young child of 11 or 12?
can a young person get breast cancer?
Yes, it's very rare, but there are cases in the literature. I attended the annual breast cancer conference in San Antonio this year, and one of the doctors from one of the western states presented a child of 11 with breast cancer. The youngest one in the textbooks is 3. But it's a particular, very rare form of breast cancer, and it's very unusual when it happens. And it's very treatable.
Is there any particular ethnic group that seems to have more?
Not more. African American women tend to be diagnosed later and tend to have a more difficult course of treatment, but not in any particular ethnic group. It seems to be across the boards. Latina women seem to have a slightly less chance, but for the most part, it's just dependent on the fact that you're a woman.
Thank you very much.
You're welcome. Thank you for calling.
Talking about treatment, have any alternative medicines been shown to be somewhat effective?
That's kind of tricky. We usually call it complementary therapy now because a lot of our women want to investigate all the possibilities, and that's fine. You should look at everything. Some of the vitamin therapies, vitamin E, selenium, can be helpful, again, only with your doctor's permission. Women, if you want to consider complementary therapy, relaxation techniques, or using meditation, yoga is wonderful. It tends to help. There was a big fad a couple of years ago for shark cartilage till they discovered that it doesn't work. There's a lot of investigation going on with various herbal medicines, and there's a lot of interest in soy. People have been downing soy products at a ferocious rate. One of the things that came out at San Antonio was that overdosing with soy, because it contains a plant estrogen, can be dangerous. So be very careful about the amount of soy you're taking.
Which is just another good reason to always keep your doctor in the loop when you're...
I think the hard part is many doctors are not really good about nutrition, so that you want to consult a nutritionist, someone who's familiar with oncology and with the nutrition that goes along with it. A lot of my patients use herbal medicines along with it, with whatever their Western treatment is, and they seem comfortable with it and seem to be doing that. Is it efficacious? We don't know. But Chinese medicine has been around for thousands of years, and people feel comfortable with doing that. As I said, meditation, yoga, relaxation techniques are all things that are helpful, and I would certainly recommend trying some of those. I would be careful about who you go to as a practitioner. There are no licensing standards for herbal medicine in New York State. So make sure you get a good background on who you're going to. Many of the major medical centers of the big hospitals have nutritionists on staff and people who do deal in herbal medicines, and you can consult with them.
Right, because you don't want to do more harm than good.
Well, the other thing is, too, you don't want to take something that you don't know the results of. For instance, people who, menopausal women, were taking black cohosh, and it's fine, or primrose oil, but they do contain estrogen, and if you have a history of an estrogen-receptive tumor, you don't want to add to it. So they were taking it for the menopausal symptoms, the hot flashes that come with the chemical menopause from treatment, and they were actually not doing anything that was beneficial. So make sure you check before you take anything.
Okay. Well, you'd mentioned earlier possibility of it spreading, advanced breast cancer.
Okay. The hard part of it about breast cancer is that it can lie dormant for long periods of time. I've had women in my group who were 15 and 20 years past their original diagnosis and then have it flare again, so that we can look at it in two ways. We can look at the woman who is diagnosed with advanced breast cancer at the very time of diagnosis, and the woman who has a recurrence and then has metastatic disease. Metastatic disease means that the breast cancer cells have migrated from the original site in the breast tumor to other parts of the body and
what
have
are
taken root
the common areas where it might spread?
Okay. The most common area is the bone. it also goes to the lung, to the liver, and in some cases to the brain, so that if you take a breast cancer cell and put it in your pancreas, it isn't going to grow. If you put it in the liver, it's like, wow, I'm home. Good place to be.
Oh, boy.
So there are sites that your physician will keep checking to make sure there's no spread.
Okay. We have another caller.
Okay.
And it's another gentleman by the name of Timmy. Timmy, when you're ready, just say hello and we will answer any question you might have.
Hi, Tim.
Tim? Tim, are you with us?
Yes. You were just talking about a soy product, and one of my friends switched from dairy product to soy products. So can you elaborate a little bit more on soy products?
Well, it depends on what they're using. A lot of people are using tofu, which is a soy product, and it's fine. You can't eat huge amounts of it. It doesn't have much flavor. A lot of people have switched to soy milk, and again, that's fine, as long as you're not over-consuming it. If everything you eat is based on soy, it isn't a good idea. But a lot of people enjoy soy milk, and using it in your coffee or as your choice of dairy product is fine, as long as you don't overdo.
What is too much?
That's kind of hard. We don't know exactly what too much is, but if you're saturating yourself, as everything you eat is connected to soy, and you're not eating a balanced diet of fruits and vegetables, which are important in terms of dealing with breast cancer and nourishing your body, then I would look at how much soy you're taking in. It also depends, too, on, is this person somebody who's diagnosed, Tim?
Yes.
Yeah. It also depends, too, on the type of tumor he or she has. If their tumor is estrogen receptor positive, then you want to think about the amount of soy you're taking in, because soy does contain a plant estrogen, and you don't want to give the tumor anything to feed on. I would suggest that whoever it is consult with their physician and consult with a nutritionist about how much soy they're actually taking in.
Thank you so much.
You're welcome.
Okay.
We were talking about advanced breast
Yes.
cancer.
What are the symptoms and warning signs?
The warning signs can be very vague. With the bone, you'll know it. The bone pain is excruciating. So when you begin to develop that ache, that persistent ache that doesn't go away, or you find that it's difficult to stand or to move your shoulder, or there's pain in your arm when you're moving it, you'll know bone pain is very prevalent. With lung cancer, sometimes it's a cough that doesn't go away, or shortness of breath when you're walking or exercising or just doing things around the house. With liver, it can be pain in the sign in the upper right quadrant, because the capsule on the liver doesn't expand, and if there's any evidence of disease, it gets stretched and it gets uncomfortable and tight. So usually the most common symptom is pain, but sometimes there is no symptom. Your doctor should be monitoring you along the way. If you've had a diagnosis, you'll be going for regular blood work,
Right.
and he or she will be doing regular follow-up to make sure that you're not presenting with any symptoms. If you do develop bone pain, the most common test is a bone scan. It's painless. They inject a radioactive dye. You wait an hour or so, and then they take pictures, and that will spot where the spots on the bone are.
Okay, and I believe Christine is back. Is Christine with us? Whenever Christine is ready, she should just say hello. Christine?
Hello?
Christine?
Yes. Hi, I just have a question. I wanted to know about it's called Dong Quai. It's an herbal product. I just wanted to know if that's
Dong
okay
Quai?
to take.
Yeah, I've heard of the product. Some of my patients use it. I don't know much about it. It's supposed to have some efficacy with cancer. I don't think there's any hard research on it yet, but there's a really good site. The NCI has a wonderful site about herbal medicine that will give you a lot of that information, or you can use the Cancer Care site and use the link to get to it. Ours is www.cancercare.org, and it has a link that will put you into alternative therapies and will give you some more information about it.
Okay, thank you.
You're welcome.
Yeah, thanks for calling. Okay. treatment of advanced breast
advanced
cancer?
breast cancer. Depending upon, again, where the breast cancer has migrated to. We spoke a little bit earlier about the drug Femara, which is a new hormonal therapy, which is done very well with advanced breast cancer patients. There was aromastatin is another drug that they're using, aromacin. All of these are some of the newer therapies that are just coming into play with advanced breast cancer. There are various chemotherapy combinations, so if the adriamycin and tamoxifen didn't work, or there's Taxol, there's Gemzar, there's Navalbine, there's a whole range of products out there. What's important for you to realize that if you have advanced breast cancer, even if the doctor says stage 4, it's not hopeless. There are things that can be done for you, and many women live long periods of time with stage 4 breast cancer with a quality of life. So it's very difficult to hear. It's something you don't want to hear, but don't give up, because there are things that can be done to help you.
Now, in monitoring response to treatment, how do doctors? Are there any specifics?
There are blood tests that they will do over a period of time. Some doctors will do what are called tumor markers, a CA 125 or 129. There's various numbers associated with it. It is not completely accurate. Some people always have a false positive. Some people always have a false negative. But it's one way of looking at it. What it indicates is the presence of cancer cells that are active somewhere in the body. So the doctor would want to go further. He or she will be doing regular blood work as part of their checkups to look for any evidence of further disease. They will be asking you about symptoms. If anything does look suspicious, he may order further testing, a CAT scan, an MRI, just plain old X-rays.
Right.
But there are tests that would be done that your doctor would want to do. Some of them are not very comfortable. Being in an MRI machine for an hour is not the best thing in the world, but they are very good diagnostic tools. One of the new ones is a PET scan. It's very finely accurate. The hard part is sometimes insurance companies won't pay for these tests, so doctors are a little bit reluctant to use them in some instances. But again, checking with your insurance company, and don't be afraid to argue with them. If they refuse to pay, ask for a review.
Okay. Now, when talking to your family about your condition, I mean, how does someone explain to their children that they have breast cancer?
Well, I owe my colleague Judy Brody for this because she runs our children's program. But what Judy advises, and what I advise my patients also, is to provide age-appropriate information the minute you know what's going on. If you make this into the family secret, kids are going to pick it up anyway. They're going to hear you on the phone talking to grandma. They're going to hear you discussing it with your friends. They're going to pick up vibes in the family. Or somebody at school is going to say, guess what my mom says your mom has. So immediately when you're diagnosed, sit down with your family and explain to them what you have. Use the word cancer if the children are old enough to understand it. With small children, it's easier to say there are some bad cells in mommy's body that need to be treated, and that the doctors are going to provide her with treatment, and everybody is hopeful that she's going to be well. Answer their questions. Don't be afraid. There's the old joke about the kid who comes into the room and says, Mom, where did I come from? And Mommy does this whole big information on sex and about reproduction. And he said, oh, John came from St. Louis and I wanted to know. So don't make, don't make it too elaborate. Don't get out the charts and the pie charts and things and do it. But answer their questions simply. If you don't know the answer, don't be afraid to say, I don't know. We encourage women who are being treated to, if the hospital will let them, take the kids along and show them the chemotherapy room. And this would be for school-age child, not for a young child. Little children tend to be more upset about who's going to take care of me. So Aunt Susan will come, Grandma will come, the babysitter will be here, Daddy will be here. Some days I may not feel so good because the medicine that I'm taking will make me feel sick. Children also ask about, can I catch it? And it's important to let them know that cancer is not catching. that they can't get sick the way mommy has. And children can be very blunt, and kids, particularly little ones, have a habit of saying, "Are you going to die?" And the answer is, "I hope not. I'm doing the very best I can to be well, and I want to be your mommy for a long time." Teenagers are harder. Teenagers.
Gee, I wonder why.
Gee, yeah. Teenagers are in a world of their own, and they tend to be very closed off. So they tend maybe not to ask so many questions, and you've done this big explanation, and the kid says, "Okay, can I go now? You know, my friends are waiting at the mall." They tend to use other resources other than the family. Sometimes it's a teacher or somebody they're involved with, a coach at school, sometimes friends, parents, their own peers. The important thing is to make sure that they're getting good, accurate information, right, so that even if they're not asking you, tell them. Don't expect them to respond, but make them part of it. Teenagers are more concerned about, does this mean I can't go to college, or, what happened to the $100 pair of sneakers kind of thing. But most teenagers can be really very sensitive, very caring in terms of their parents, and that goes for both girls and boys. And they tend to internalize it, so they need a lot of support in terms of getting through this. The things you want to watch for are a group of friends that you don't know, right, staying out late, a change in study habits, so that if their grades are falling, then you know there's something going on, and they may need professional help.
Reacting badly to it.
Yeah, but they're not saying anything. With little kids, they revert, they become baby-like. They may start bedwetting again, or sucking their thumbs, or become very clingy. School-age kids, again, you want to look at aggression. Are they becoming aggressive with their siblings or with their playmates? You want to look at falling grades in school, a change in eating or sleeping patterns. Be sure and let the school know that if you're going to be on treatment, and there are going to be days when you're just not feeling well, so that the teachers in the school is aware that there might be times when you're not as available to your child.
Right.
Explain to your children that you're not going to be able to do some of the things, driving to the soccer game and then out for pizza and, to violin lessons and whatever, that you may have to set up a carpool with somebody else, but somebody will be there to help you do those things. Try to keep their lives as balanced as possible, but help them to understand that you are ill, and that there's nothing wrong with being ill, and that you're going to need some special attention right now. But be open with them and be honest with them, because there's nothing worse than children coming in, and we get grown women who come in, or sons who come in and say, "My mother never talked to me. I didn't know how sick she was." And the worst thing is, "My mom died, and I never had a chance to say goodbye." So make sure that your kids are aware of what's happening in your life. Make them part of it. If they're doing something, you want them to come to you and tell you. So we can't say, "You can come and talk to me," if you won't come and talk to them. So give them a chance to be a part of it.
So generally, I think kids are pretty resilient. I mean, they can be a tremendous...
Kids are really very, surprisingly resilient. It's amazing. We do have a children's program. We have children's support groups. We have counselors who work with them, so that there is help that's available for them. Sometimes they need play therapy to help them get through this. And this goes for the rest of your family, too, not just for your kids. Talk to your partner, to your husband, to whomever. Talk to your parents. People very often will say, I can't tell my parents. They've gotten through life with a lot of bumps, and unless they're physically ill and their doctor doesn't think it's a good idea, tell them what's happening in your life. It's far worse for them to hear it from somebody else.
Right.
But don't be afraid to tell people what you're experiencing. Women have a tendency to want to fix everything. We're great fixers. We take care of the plants and the cat and your parents and the kids and your job and everything else, and we don't take care of ourselves. So it's important to ask for help when we need it.
Okay. And what happens if you don't have a family to support, or even a tight circle of friends?
I would certainly suggest calling the agency and getting some help, getting part of a support group. My support group, my breast cancer support group, is a community unto itself. They have driven one another to appointments when somebody has nobody. They've cleaned houses. They've provided food. They are a wonderful source of support. If you're really on your own, there are times when we can provide financial help so that you can hire somebody to come in, a housekeeper or somebody to come in and help you with personal care. But don't be afraid to reach out and ask. Churches are wonderful sources of help. If you belong to a particular religious group, they are very often just absolutely great about supplying emotional support and actual hands-on care. So don't be afraid to let them do something. There's a particular group on Long Island, one of the PTAs, who set up a whole system whereby you can call in and say, I've been diagnosed, and they will come to your house with meals. They just show up with dinner on the doorstep, and they will help you get to your appointments. There are grassroots organizations such as the Babylon Breast Cancer Coalition, which has a program called Helping Hands, and they will send people to help you. So there's all kinds of help. Don't be afraid to call us and ask, and we can very often steer you to help.
You know, one hand reaching out and you have 10 hands reaching back.
Absolutely. And it's amazing how well people respond, that they really want to be there and to do something. So all of those programs are out there, they're available, and we can connect you to them.
Okay. Well, just in summation, we have about 3 minutes left. It flew by.
It certainly did.
And are there any heavy points that we've missed?
I think you've covered everything very, very well. I hope I've answered everybody's questions. But the thing I want to stress most is don't try and do this alone. Get help. It's hard. We know it's hard, but there are people out here who do care, and we will be able to help you.
Okay. In the first half hour, you gave an overview of Cancer Care's. Could you repeat that overview of what Cancer Care is all about?
Certainly. We're a professional counseling agency. We provide counseling free of charge to cancer patients and their families, both in group and individual format. We provide it from pre-diagnosis through diagnosis, hopefully through cure and treatment, unfortunately sometimes through death and bereavement, but we're there for you.
Okay, and you have offices throughout New York and Long Island?
Yes, we do. We also have offices in Connecticut and New Jersey. They can call our main number and be referred to the proper office.
Okay, and the toll-free number is 1-800-813-HOPE?
HOPE, yes.
And offhand, what are the numerical equivalents to those?
You know, I don't know.
But 1-800-813-HOPE, that's Cancer Care's toll-free number. The website is www.cancercare.org. And you've covered so much information tonight. I want our viewers to check out the Talking About website, www.talkingabout.info. We'll have links to Cancer Care's site. And thank you for joining me tonight.
Thank you, John. It was my pleasure.
Thank you for watching, and I hope to see you again real soon. Bye.